In this video, we will discuss decompression sickness, a potentially life-threatening condition that occurs when dissolved nitrogen in the blood forms bubbles due to rapid ascent from deep water. This leads to tissue damage, neurological impairment, and cardiopulmonary distress. Here are the key concepts that you should know about decompression sickness. DCS occurs when a diver ascends too quickly, meaning that when they are deep in the water, they go up back to the surface too quickly. This causes nitrogen gas, which was absorbed under high pressure, to form bubbles in the bloodstream and tissue. These bubbles can block blood flow, trigger inflammation, and damage organs. When a person begins to go deep into water, the pressure decreases the size of the nitrogen gas. This allows nitrogen gas bubbles to seep into small blood vessels where they normally cannot get to. If the person ascends too quickly, the nitrogen gas bubbles that are small and in those small blood vessels cannot get out of the blood vessels before the person returns to the surface. As the person returns to the surface, the gas expands because the pressure in the body decreases. This is how the nitrogen bubbles get stuck in the bloodstream and tissue. Patients experiencing decompression sickness, also called the bends, suffer from joint and muscle pain, dizziness, numbness, confusion, difficulty breathing, and skin mottling. Severe cases can cause paralysis, stroke-like symptoms, and cardiopulmonary collapse or cardiac arrest. Again, decompression sickness is a diving-related emergency that requires urgent treatment, specifically with a hyperbaric oxygen therapy chamber. This is the only way that we can get the nitrogen bubbles back to where they belong. If you hear that a patient was recently scuba diving or free diving and they present with these types of symptoms, you should immediately be concerned about them suffering from the bends or decompression sickness. In regards to treatment, you should provide supportive care and rapidly transport them to the hospital. In many cases, the supportive care will include high-flow oxygen administration and specifically transported to a hospital that has a hyperbaric oxygen therapy chamber. ALS providers may be able to initiate IV access and administer additional treatments if indicated. Want to watch the full video? Watch the full video and get so much more with your full access membership by going to howtonremt.com or scanning the on-screen QR code now.